Reads the care plan.
Come in.
Washes hands. Good morning, Miss Jones. My name is Jaira. I'm going to be your CNA for today, and I'm here to take your blood pressure. Before we get started, may I have you to confirm your name and date of birth?
April Jones, 123.
Awesome. I'm going to pull the curtain to offer us some privacy. I'm going to take your call bell momentarily, making sure that your bed is locked and lowered. I'm going to have you to sit up and dangle your legs over the bed. And we're going to have you to lift your legs to put them over the bar. Alright. Let's get an alcohol wipe to clean our stethoscope. Making sure that we clean the ears really well. And that we clean the dial. Is there a preference on which arm you would like to use today?
Left arm, yes.
All right, let's go with your left arm. I'm gonna palpitate the arm to find the pulse. I have it located. I'm gonna open up the cuff. Placing the cuff over the arm. Leaving about 2 fingers width of space to place your dial, making sure that the cuff is snug. That comfortable for you?
Yes.
Okay, perfect. I'm gonna turn the ears inward. Making sure that I can hear. We're gonna inflate the cuff between 160 and 180, not to go over 180. And we're gonna listen for top beat. All right, Miss Jones, we got that temperature, that blood pressure on you. We'll get your cuff out. All right. I'm gonna have you to lift your legs. So I'm gonna take this away and return your roll back to its nice and neat state. Okay. I'm gonna return that call bell back to you, making sure that your bed is locked and lowered. I'll be back to visit you in 2 hours. You need anything, don't hesitate to use that call bell. See you back in 2 hours. Wash his hands. Records temperature. Records blood pressure. Blood pressure is recorded.